Hi everyone! This week's lab includes articulations and body movements. So when we're talking about articulations, that's just the scientific word for joints, where bones come together and move against each other. So we classify joints in two different ways. There's the functional classifications, how much a joint can move. If a joint can't move at all, it's a synarthrosis, so that means immovable. If it's slightly movable, it's an amphiarthrosis. And if it's freely movable, it's called a diarthrosis. We also classify joints by structure. We have fibrous joints where bones are connected by dense, regular connective tissue. There's no joint cavity, so the sutures between the skull bones are a good example of a fibrous joint. We have cartilaginous joints where bones are connected by cartilage. Again, no joint cavity, and the pubic symphysis is a good example of a cartilaginous joint or a cartilage joint. And then last, we have synovial joints, and a synovial joint includes hyaline cartilage as articular cartilage. It has a joint cavity and a synovial membrane. And a knee is a really good example of a synovial joint. So structures in common to all synovial joints include a ligament on either side. Ligaments are found on each side of a synovial joint to give it stability. The next layer that we see is the fibrous layer, and the fibrous layer is continuous with the periosteum. And then inside the fibrous layer, we find the synovial membrane, and the synovial membrane secretes synovial fluid. The fibrous layer and the synovial membrane combined make what's called the articular capsule. And it's good to remember that right here, there's articular cartilage, some hyaline cartilage that makes it easy for the bones to slide against each other. So we're going to just go through a few other types of joint classifications. And so here is a joint called a hinge joint. And a hinge joint is any joint that moves only in one plane. So the joint between the humerus and the ulna is a hinge joint. Those bones can only move in one plane. There's a ball and socket joint, which is kind of freely movable. All right, we can rotate our humerus in the shoulder joint in all sorts of directions, multiple planes. And then we have a pivot joint, like the radius and the humerus. So the radius pivots on an axis, okay, on one axis. And the last thing I want to do regarding articulations is look at the knee, because the knee joint experiences many, many injuries that are pretty significant and often require surgery. So here we are looking at the knee, and the kneecap, the patella, has been pulled back. Below the patella is the patellar ligament, and above the patella is the quadriceps tendon. Okay, here is the condyles of the femur, and we see the tibia here, but above the condyles of the tibia, we see what's called a meniscus. We have a lateral meniscus and a medial meniscus over here. And those cushion the bones, right? So they are there to kind of absorb shock. Okay. Forming a cross in the middle of the knee joint are the cruciate ligaments. So cruciate means cross, and so we have an anterior cruciate ligament and a posterior cruciate ligament. Okay. So just again, we have our patellar tendon below our kneecap. We have our quadriceps tendon above our kneecap or patella. We have our condyles of the femur. We have above the condyles of the tibia. In this illustration, we can see the lateral and medial menisci. Okay, so one meniscus, lateral meniscus here, medial meniscus here, and we see both the anterior and posterior cruciate ligaments. We're going to finish this video by looking at movements. So we're going to talk about flexion, extension, and hyperextension for the neck. If you move your head towards your sternum, that's flexing your neck. If you return your head back to neutral, that's extension. And if you look up at the sky, that is hyperextension. Our arms, we talk about, in addition to flexion and extension of like flexing the elbow, bringing the forearm closer to the upper arm and straightening that out for extension. We also talk about abduction and adduction. Adduction, I want you to think of adding, and you add your arm to the midline. In abduction, you take your arm away from midline, so it's being abducted. Circumduction is when you make circles with your arms. That's, I guess, circles in the air with your arms. It's a little hard to describe, but I think the picture does it justice. We can talk about inversion and eversion of the foot. So turning your foot in towards midline is turning it in or inverting it, and turning it away from midline is eversion. We have dorsiflexion, pointing your toe up as well, I guess flexing your toe, and plantar flexion, which is pointing your toe down. And we have pronation and supination. So pronation is turning your hand over, and supination is turning your hand up. So when I was in anatomy and physiology, we were taught that, think about holding a soup bowl. If you can hold a soup bowl, you have supinated your arm. And if you could not hold a soup bowl, if you spill soup on the ground, then you've pronated your arm. And we have rotation. So we can rotate our head on the axis of our cervical spine. We can rotate our legs medially and laterally. And so that's rotating at the hip, and moving the foot in would be medial rotation. And again, rotating at the hip and moving the foot out is lateral rotation. And that covers the movements. So I hope you find this helpful. This is what I expect you to know for next week's quiz. The MIPS go into more detail, but considering the current climate, this is the extent that I expect you to know. Take care, and I'll see you next week.